Awesome. Thank you. Well, good evening, everyone. Welcome to the Council for Minnesotans of African Heritage Full Council meeting. It is 6:04. We're a little behind because you all know that I start on time. But we're going to go ahead and call the meeting to order. So if I can get a roll call done from CMAH staff, that'd be great.
Of course. I'll be doing roll call this evening. So first and foremost, Chair Hughes.
Present. Carl, we just need you to mute for a minute because we hear your background noise. Thank you.
Thank you, Councilmember Crawford. Vice Chair Doe.
Present.
Excellent. Okay. Treasurer Mullins.
Present.
Perfect. And then Secretary Adams Lee. Not here yet, but we'll circle back. Council Member Daniels. Righty. Council Member Crawford.
Present.
Thank you. Council Member Nadi.
Present.
Excellent. Thank you. Council Member Winston. Alrighty. Council Member Dukes. Okay. And then Council Member DeHeer. Alrighty. And then Senator Fate. Alrighty. That ends roll call.
Awesome. Thank you. And then if I can have a motion to adopt the meeting agenda, if there's no changes that need to be made.
Madam Chair, I don't know if you want to look at the agenda with the addition of the full groups that will be joining us today. I have that available if you want to have the.
So, and I just wanted to get clarity, were they actually speaking or?
They are speaking.
Okay. So we do just have some edits to the speakers. So it will be, I know Ben Michi and Derek Emery, and is it Sadia Muhammad?
And those are the visitors. And so Derek is from MDE, but
Okay.
also we have a couple of different groups that will be presenting as speakers. And so I can share an updated agenda if you so desire.
I would just say put it in the chat. If it's going to be
Okay.
within that same section, then I think we're fine.
Okay, perfect.
So just note that there will be additional speakers besides what your original agenda states, which is representatives from D, Children's Cabinet, and Minnesota Department of Health. Is that correct?
That's correct.
Okay, so with those
DHS.
and DHS, thank you.
Yes.
And so if we can have a motion to adopt the meeting agenda with those additions, that would be awesome.
So moved.
Thank you, Tawana. And is there a second?
So second, go.
Thank you, Wayne. Any further discussion? All in favor, either just type in the chat aye. If you oppose, nay, and if you abstain, then put abstain. And I think it's just easier to use the chat instead of having everybody unmute. Or is it easier to unmute because I don't see anything in the chat? Why don't we just unmute? Because Carl, are you driving?
Yes, Carl.
Yes, Madam
Okay,
Chair, I'm
so
driving right now.
yeah, so if all in favor, just note by saying aye, just unmute and say aye.
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 Aye, Wayne.
Hello.
Any opposed? Same. Any abstentions? Motion carries. Consent agenda item, the only thing that we have is the approval of the January 2023 minutes. Were there any additions or corrections? And if hearing none, if I can have a motion to approve the January 2023 minutes.
So moved, Crawford.
Thank you, Carl. Is there a second?
Second Mullins.
Thank you, Tawana. All in favor, say aye.
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 Any opposed? Any abstentions? Motion carries. All right, we are on to our financial report. Tawana, I'm gonna turn it over to you.
Thank you. Okay. Let me know when you guys can see it.
We can, but
Yes.
I don't know if you can make it a little bit bigger.
Bigger? Oh, okay, it's zoomed in for me. So let me. Is
Yeah,
that
that's
bigger or
good.
bigger than
Yep.
that? Okay.
Nope, that's good. Thank you.
Okay. Okay, so we currently are sitting at 136,000 in unobligated. But a good chunk of that is going to go away with the Day on the Hill expenses, and a few more that Linda mentioned. One thing to note that I did notice, and I confirmed with Linda, is that there are a lot of us who are missing per diems, and we're coming up on a deadline for those. So if you know you're missing some, you can get them in. Otherwise, I know the council is compiling the missing requests, and they're going to send them over to me, and I'll be reaching out to you. I don't know if we have an exact date of when that deadline is coming, but I do know it's coming soon with the fiscal year ending here pretty soon. So you want to get those in. I don't have anything else. Oh, the other expenses in the 136,000. There was some marketing, some research that the council's interested in, some supplies, in addition to the Day on the Hill that's going to tie up a good chunk of that 136,000 that's unobligated currently. But I don't have anything else. So if anyone has any questions for me.
No, but I am gonna put a deadline. We meet again the second Tuesday, and I believe it's March 14th is when we meet again. So that's what I'm giving you all until. You have until March 14th to get in the remaining of your per diems. Because it
Linda, do
shouldn't
you
take.
know when you'll get over those missing ones to me so I can at least get those out to them? They can know if they're missing any.
Yeah, we should be able to do that by the end of this week, or at least by Tuesday for sure.
Okay, okay. And as soon as she gets those over, depending on timing, I'll try to turn that around quickly so you can at least know and get that back over.
Perfect. Any other questions in reference to the budget? Again, more so for guests. The budget is, we don't vote on the financial report because it really is informational purposes. But then again, because of the way our agency is designed, that's why, as you looked at the manager's financial report, you're seeing more dollars that come from salaries than programming, because that's not necessarily how the council is designed from a programming perspective. So with that, if there are no other questions, go ahead, Wayne.
Yeah, a couple of questions. One for Councilmember Mullins. When you say a bit of a chunk of the amount will be tied in the Day on the Hill, rather, is that a significant amount? Like, do you have?
I didn't get an exact dollar amount from Linda. When I did ask, did we have a plan to expend some of those dollars down? She did say that they planned with all of those four things, that they planned that the amount was going to come down significantly. Linda, do you have an exact amount?
Yeah, we're still doing some marketing, but it'll probably be close to 30,000 for that expense. But then also we're looking at doing some type of event at the end of the fiscal year. We had that conversation about doing a reception, so some dollars will go towards that as well. Branding dollars, we've got to replenish T-shirts and things like that we hand out in the summer. We need new banners. There's we need to spend money on the office in terms of updating the equipment so that when we do move really fully back into the office, that we'll be able to have those meetings, those virtual meetings through the office as well. So there's a number of expenses that actually fall up under that budget, in that budget.
No, thank you, Linda. It was just the Day on the Hill part I was looking at. But also regarding the per diem, I think you have mentioned before, we can just use one form and just put the dates on there, right? Like we don't have to do each month, right?
So
Okay.
yeah, if you're missing a lot of months, you can just list them out all on one.
Okay, yeah. Sounds good. Okay, thanks.
Any other questions or comments? All right, so we will move to our speakers. Look at that, we didn't caught up already.
Okay.
So we will move to our speakers. I'm gonna look at, and actually, Linda, I'm gonna turn it over to you to kind of call out who should go first, because I don't know if they're doing this as a collective or how it's actually being done. So let me turn it over to you to do the introductions, and then they can present from there.
Okay, so DHS is up first, and I'm pretty sure that they coordinated who was going to go. I have a list: Dan Ashby, Christy Grame, I'm not sure if that's the correct pronunciation, you can correct me, and then Shanine, Deputy Assistant Commissioner, will be speaking. So I'm not sure who's definitely going first, so I will let you guys handle that.
Hi, good evening. I think that's my cue. I'm Anna Ashby from DHS. Is someone able to share the PowerPoint across the different agencies? Helen is raising her hand. Great.
Yep, I'll do that shortly.
Perfect.
Love Helen being prepared. Thank you.
Can you see this okay?
Yes, perfect. All right, well, I can kick it off for DHS. I don't see Christy on the call yet, but assuming she'll be joining us any moment here. Okay, thanks for having us, everyone. I'm Anna Ashby. I'm the Legislative Budget Manager for the Healthcare Administration at DHS, responsible for basic care and the medical assistance in Minnesota care programs. Can move to the first slide, please. So I'm going to be presenting on some of the relevant pieces of the governor's budget that we wanted to make sure you all were aware of. So first of all, what we heard from folks is that Black families want access to health insurance that's easy to enroll in, maintain, and that you can use to receive affordable, culturally competent care. I want to note that many of our proposals came out of the Building Racial Equity into the Walls of the Medicaid Program, or the BRU report, that Dr. Chomolo was responsible for sort of compiling, that I know many of you are aware of and were involved in. So I want to do a quick call out for that. So there are 4 proposals in this realm. I'll kind of go through them briefly and dive into them in a little bit more detail on the next slide. First, we have continuous eligibility for kids up to age 6. So that means that whether you are born onto the Medicaid program or you enter the Medicaid program before age 6, under this proposal, you would be able to maintain your eligibility up until age 6, with the idea being that once you're kind of entering school, that's sort of an appropriate time for you to kind of reassess your healthcare needs, but make sure that you have that continuous eligibility for care to get, you know, all of your vaccines and all the healthcare that you need, sort of setting folks up for a healthy start. So the second piece is to let children who are age 6 to 21 on medical assistance have 12 months of continuous eligibility. In other words, you wouldn't see some of that churn that we currently have on the program, where month to month, your family's income might change and you might lose Medicaid eligibility. So extending that to 12 months for all kids 21 and under. There's also a proposal to allow Minnesotans to buy into Minnesota Care. So if folks are over the 200% federal poverty guideline, which is currently the income limit for Minnesota Care, giving them the option to be able to buy into Minnesota Care with a comprehensive benefit set that we know is great for folks to be able to access care. And then lastly, we are proposing to remove the doula supervision requirement in the medical assistance program. As many of you know, we are one of a handful of states in the country that cover doula services in our Medicaid program. We currently have a requirement that folks who are doulas have to bill through like a supervisor. We're proposing to remove that. We don't believe it'll have any clinical impact, but will have the effective impact of expanding access to doula services, which we know are particularly important to the Black community. Just diving in a little bit deeper here, this first paragraph is just related to those continuous eligibility pieces. Again, that continuous eligibility up to age 6 for folks, and then from 6 to 21, 12-month continuous eligibility. Again, the intent of this is really just to minimize churn on the program, to make sure that people know when I'm enrolled in healthcare, I have access to it for a consistent period of time, and having that kind of, access to care, and then also the peace of mind that comes along with, I know I've got my healthcare for the next 12 months, next 72 months. And then the other piece in here is, so this is related to the public option, that buy-in that I mentioned, which again would allow people to buy into the Minnesota Care program if they were above the current income limits. So an investment there and proposals around that as well. Any questions for me? Otherwise, I'll pass it along to Christy Grom, who I see is now on the call. All right, go for it, Christy.
Hey everyone. For those that don't know me, my name is Christy Grum, and I'm the legislative director that covers a few different parts of the department, so including behavioral health, housing, deaf and hard of hearing, and disability services. And so I'm excited to be able to share that a lot of the issues that we heard from you have been included in the governor's budget. And so this slide in front of you sort of highlights some of those proposals. So we've got an increased funding for organizations to really be able to recruit and retain more BIPOC mental health and SUD providers. So this is primarily in the Culture and Ethnic Minority Infrastructure Grant, so the CMAH grant. But we also have another grant called the Provider Supervision Grant that the 2022 legislature just passed last year. And so that's definitely a key priority of ours, to be able to make sure that people who are accessing mental health and substance use disorder services are able to access those services from providers who are both culturally specific and culturally responsive, and really so that people are feeling comfortable in being able to access those services and continue them. We've also got a pilot for mobile services. And so this is sort of a new idea that other states are looking at, where we have our mobile crisis services in Minnesota, but this is a sort of a different model geared toward youth and families in crisis. And it's really to make sure that when people are in that moment of crisis, that they've got a response right away, and that people are helping them to connect to the services that they need to address whatever crisis they might be experiencing, but also that those same people are able to stay with them for a couple of months and be able to provide ongoing support to the family unit to really be able to help them identify, there might be, were there triggers to the crisis? Are there things that we can implement as, kind of plan to make sure that we can identify those triggers early, and that we can prevent potentially out-of-home placements or referrals to child protection, which we know are highly traumatic, especially for Black and Native communities. And so we're really excited about this pilot. The hope is that we'll be partnering with several organizations across the state to implement this pilot, and then working with a technical assistance partner who really understands this model and really understands the fidelity to which we need to adhere to it. And what we're seeing where this has been implemented is that there are some really profound outcomes, improved outcomes for Black and Native communities in particular. And so we're really excited about that. We hope that what we can learn from this pilot is something that we can also translate into our ongoing medical assistance programs, so that people have access to that same type of service ongoing. We also are excited to be increasing our funding for schooling behavioral health services. So these are important services that are provided in the form of both medical assistance and grant programs, where the grants sort of cover those populations where people are potentially not eligible for medical assistance or underinsured. And they do serve primarily Black and Indigenous communities. And what we found is that these are grants where people are able to access services sooner than they otherwise would have been if they were just accessing them on their own in the community. So there's an element of people being in, the school environment, not parents not having to necessarily take time off work to make sure their children and their youth can have access to those important mental health and SUD services, making sure that kids aren't sort of stigmatized by having to leave school to get access to those services, and then identifying them with people that they know and that they work with day to day. And so they're pretty successful interventions, and we definitely hear you that there's a need for ongoing investments there. We've got ongoing investments in both our independent school districts, so kind of what you would think of as like regular school districts, charter schools, as well as intermediate school districts who serve some of our highest needs kids. And we want to make sure that they have access to ongoing supports to meet their needs and create better outcomes. Also, we're excited to be able to have in the governor's budget an increase in organizations to really help people find and maintain housing, as well as like to cover their moving expenses. So things like potentially expungement costs, things like purchasing necessary household goods to be able to establish a home, things like their first month's rent. And so we've got an increased funding for what we call the Housing Stabilization and Services Benefit. This is a medical assistance benefit. It's a newer benefit that helps people both find and maintain housing. So there's different funding categories for both of those elements. But that rate, when it was established, is sort of stagnant. It's a historic rate. It was a fairly robust rate when it was established, but we do see the need, and we're hearing the same from the communities, that from community organizations that that administer these services, that we need to have ongoing inflationary updates to make sure that the rates are such that they're able to continue to serve people, and then also to increase access to that service. We know it's a really important thing to be able to have housing, to have a stable home that you can go home to when you're struggling with other issues. On the moving expenses piece, that was a new addition to the Housing Stabilization Services benefit that the 2021 legislature passed. It was sort of an innovative idea. And we have been working with the Centers for Medicare and Medicaid Services, so the folks that approve these services, to be able to make sure that that's an ongoing benefit for people, so that they can get what they need to be able to establish their home. And then lastly, on this slide, we've got funding for culturally specific recovery community organizations and supportive housing programs. So recovery community organizations are an important facet when it comes to substance use disorder in particular. They're sort of that not afterthought, but basically aftercare when someone is accessing clinical substance use disorder services. That's an important function that our system needs to provide, but we also need to provide supports ongoing that are non-clinical, where peers can meet with people, and in particular, we can have peers that look like the people that are accessing treatment, where people feel comfortable talking to these peers who are maybe not mandated reporters, but they just really have a lived experience with, and they're in recovery from substance use disorder, and they can help guide that person to necessary or helpful resources, and can also help advocate for them, like in criminal justice settings or other settings, can help connect them with a recovery community. And we really see a need for this to be a need for our resources to be more targeted to culturally specific communities. I know There's in particular one recovery community organization that's trying to get off the ground that we know of in Little Earth. And I'm sure there's others in other, in the Black community and other communities where we need to really invest to make sure that those organizations can be successful and so that people can access those culturally responsive services.
Did you want to cover this, Christy, or is it just more expansion?
I don't know that we need to cover this slide. I think we kind of covered what we could, but I'm happy to answer any questions or provide. There's a ton in the governor's budget on these topics that I think will be really important investments and responses for the disparities that we're seeing. So I'm happy to answer any questions that people have.
So are there any questions? Wayne, I see you were unmuted. Go ahead.
Yeah, I have a quick question. And first of all, I really appreciate the fact that listening to the community and putting in these programs. My question centers around the fact that so the grant program that providers of organization will be accessing, are we concerned about the ratio of the folks that usually will get the grant as opposed to the broader community that have organizations that probably haven't, reading a grant before or know how to do that. So most likely, the grant will go to organizations, established organizations that have been doing it for some time. So my question would be, what would you say to us, either as an organization, a council, or just a community, as to how prepared we can get to access the grant program so that a broader group of organization and providers can benefit from there to help the people?
Thanks for raising that. It was Dwayne, is that, or Wayne? Sorry, I didn't see your name.
Yes, Wayne.
Wayne, thank you, Wayne. Yes, that is something that we've been talking about and sort of strategizing on internally, is like, if we're really going to be an anti-racist organization as DHS, like how do we really get money into the hands of the communities like quickly that need that funding to be able to move the needle on disparities? And they're, quite egregious in many respects, especially in the substance use disorder area. So while it's not in this presentation or the budget today, those are conversations that are ongoing, things that we're thinking about for potentially the revised governor's budget around what can we do to actually provide money to organizations to do sort of training and technical assistance and to be able to spread that knowledge to other small organizations. What can we do to make sure that where possible, we can actually sole source funding? We are very aware of the challenges of grant making, and some of those challenges we can't necessarily address. Some of them we can. We're hoping to bring forward some provisions that will simplify the procurement process. But we're also looking to maybe look at how we can sole source grants. And I think part of that conversation needs to be had with the community on that, on if we're actually going to name organizations in law and say, we want to make sure that you get this funding and that you don't have to maybe jump through the same kinds of hoops that you would if there was a competitive process. We also want to make sure that we're not making that determination as an agency, like on who we think those organizations are. So we really need to do more work with the community, and we'd love to partner with you on helping us identify those smaller BIPOC organizations that we can actually get money to in a more efficient manner. That is definitely a priority of ours.
Thank you.
Council Member Adams Lee, I see your hand is raised. Go ahead.
Yes, good evening. Thank you. So my question is related to the mental health providers, and I think this is marvelous. This has been a long time coming, but we still have providers who perhaps were licensed at, let's say, at the LPC, LISW. They're independent, they do clinical work, they're providing these services and would love to have their own, and it kind of springboards off of Councilman Doe's question. It's around providing those services to those that look like us. And how about we're trying to have our own agencies, or we're trying to be an independent provider, but cannot some of those individuals just have, their own trauma, their own test anxiety, all those kinds of things, and they are not able to, let's say, pass that clinical test. And so I know several years ago we had the grandfathering in the social work area, but it still did not. It was intended for those. That was the intention. However, we still came away wanting, or sort of limping away, and others that are not of the BIPOC community benefited from that grandfathering. So my question is there components that are built into this marvelous way of providing services to our community with providers that look like them, that will also support that independent licensing for insurance billing purposes? Or are there going to be some augmentations to that licensing so that they can have a variance until they can take the test? Those kinds of things. I'm wondering, has that been addressed this time through some of this great work that you guys have done around the mental health?
Yeah, that's such an important issue, especially around the testing and, and not just in mental health, but other areas of the kinds of regulatory and testing requirements we have for many professions seem to disproportionately bar Black and Brown communities. I mean, some of my experiences in that is in the legal world, but it exists here too. I think the DHS proposal, because we don't necessarily have, it's not really our lane, although we have opinions of making some of those like licensure changes. That is something that we're working on through, there's an existing task force that I can't remember the exact name of it, but I want to say it's like the Culturally Responsive Mental Health Task Force that was established in 2021. And I think it was Representative Vangsville back then, that they're working through some of those issues. DHS is helping to support that work. I know that they've had a preliminary report, but I don't have any updates on exactly what like some of those most recent recommendations are, but I would love to share those with you, and I would love to provide you with a work of, at least what they're doing so that you can plug in where it's possible for you to be able to voice your concerns there. So I'm with you, and we're with you at DHS on that.
I'm on that task force, and we have not gotten any, we've not gotten any traction nor any feedback around that. We've offered to partner with some of the licensing boards and helping to talk about how we can help to facilitate that, because essentially what we have learned is that we are going to end up, we have all of these great policies and movement and so forth, but if we don't have, if we're still, if our folks are still having trouble passing the test, then we're still at the same place. We're still not, we don't have the adequate amount of Black and Brown providers. And then, it's sort of like we spin our wheels. So I am a part of that task force. I have been a part of that task force, the behavioral health, people of color, behavioral health planning and task force, been a part of that for about 10 years now. And it's, yeah, you're right. There's a disproportionality around testing because we don't test the same way those tests are not written for us. And so I know that that's a larger conversation, but we were hoping as a part of the task force that we would be able to come away with a breath of fresh air and say, wow, we can have something. So I'm disappointed, but I mean, and I don't quite know how to address that.
Yeah, I really appreciate that. Sometimes it's like, just like this stuff is taking forever and we don't have time, right? So I think maybe what I would like to do is connect with you and Nirja Singh, who I know is supporting that task force, and there might be others to maybe strategize on how we can, even though it's not totally the DHS lane, how we can try to really push for more expedient solutions there, because I totally agree with you. If we can provide all the supervision in the world and recruit all the people that we can, but if people are, if the tests are set up in a way that's not, that essentially is biased, then what are we doing here? So thanks for raising that to my attention, and hopefully we can connect offline on that.
That would be marvelous. Thank you, ma'am.
So Councilmember Nandi, I see you have, is it a quick question? Because we have several speakers.
Sure. Thank you. This is Councilmember Jude Nadi. I just want to follow up on the procurement part from the department, especially for the organization that access the bids and the RFPs. So I know it's very challenging at state level because when it gets up to $10,000, $25,000, it goes to RFP and then it's outside your control. So since we have some work we are doing on that, changing some of the approach, I would like us to connect more to discuss, to know the approach, because you may have the good intention, but at the end of the day, because there are so many statutes that rub against Black and brown people, the attention may not be as you plan it to be. So I would like us to discuss more to see the opportunities and how we can support that drive to help communities in our area to access those fundings, especially when it goes to bidding.
That would be really wonderful. We definitely want to try to promote things as much as we can, but we know that we're not the experts here, the community is. And so we also, don't want to like put it on community to do the work. We want to be able to do the work ourselves, but to be able to engage with you on some of those issues would be really important in our work ahead. So I would love to connect with you and connect you with the right people who are doing some of that work at the department, so we can make sure you're engaged and all of your voices are heard and all of the issues that might be blind spots to us are addressed.
Thank you.
And Chrissy, I'll just add before the next presenter, and I think Linda, you have put it in the chat that this is where we can really partner on being able to identify some of those organizations and, kind of doing a co-hosting, if you will, with some of these community conversations. So I just want to throw that out there as well.
We would love that so much because we're kind of in a hard spot where we don't want to put, sole source organizations or miss people, or we want to make sure we're capturing everyone. If that's, what the plan is. And I think it's a good one. So we would love to partner. Thank you.
Awesome. Thank you. All right, I'm turning over to the next speaker.
Hi, I'm Stephanie Hoganson, and I'm the policy director with the Children's Cabinet. And for those of you who haven't heard of the Children's Cabinet, it's an interagency partnership with 22 agencies, a few of whom are on this call, that work together to fulfill the governor and lieutenant governor's charge to make Minnesota the best place to grow up. And I just want to kick off the conversation too and say that a number of our agency partners weren't able to be here tonight to share some of the key components of the governor's budget in their areas, like the Department of Education and DLI and housing. There's some really exciting investments and proposals in those areas. And always happy to work with and make connections. I know some of them were invited and just couldn't make it, but I know the conversation would be great to continue about the broader budget. But I'm going to start off the conversation, and I know I have Deputy Assistant Commissioner Moore with me from DHS. The Children's Cabinet helped co-lead an interagency budget development process with Assistant Commissioner Tiki Brown over the Department of Human Services Child and Family Services Division and former Commissioner Mueller at MDE in collaboration with the agencies in the Children's Cabinet to be able to do cross-agency budget development and sharing, as well as ensure we kind of heard from key partners and stakeholders and service providers on what should be in the budget in a more coordinated way. And where we landed is what I'll do a brief overview of today. And like I said, it's a nearly $16 billion package for children and families. And so it's hard to touch on all the pieces, but hopefully this is a good conversation starter. So the package includes $6.9 billion for education and education workforce programs with a focus on expanding, increasing the numbers of teachers and educators of color. And like I said, we won't be able I won't go into depth about the education package significantly since our MD isn't here, but eager to make any connections as needed there. And I know they're willing to engage too. And part of that package also includes $3.4 billion for early childhood. And the second largest component of the governor's budget is $2.3 billion over 4 years to create a nation-leading state child tax credit that's modeled after the federal child tax credit that expired after a little over a year of advance payments to families. And this tax credit would be $1,000 per child up to $3,000 with an income limit of around $50,000 a year. So reaching a little bit into those higher income families. And it also includes other historic tax relief, advance payments, a significant expansion of the state child independent care credit, and other economic boosts because we know when we increase family income, we improve child outcomes. And Christy already talked about the DHS components of a mental health package, and there's also significant investments in youth supports in the childcare industry and access. So I'll just touch on, you can go to the next slide, a couple of the package highlights. So Christy's talked about the DHS components of the mental health package. I think it was about a $280 million package for children's mental health. Other components that haven't been touched on yet are a significant investment in expanding student support personnel. So those social workers, counselors, support staff in schools that we have a need for to support our youth and address the kind of mental health needs that have escalated, particularly during COVID and in the last few years. Christy spoke to some of the diversifying the workforce provisions, and then I know MDH might speak to their adolescent mental well-being grants to support community in kind of the broader mental health promotion and well-being needs. And for out of school time, MDE has investments to expand or actually reestablish funding expired for an after-school community learning grant program that has a focus on culturally specific programs. There's a proposal to increase youth intervention program grants that go directly to communities and other youth employment supports. And then at the bottom, you see that the youth justice prevention and reform also includes community-based grants to organizations for kind of multifaceted approaches to support youth. So that's just a highlight of the mental health package. And on the next slide, I know there was, Anna already talked about kind of the provision around doulas, but there was a broader effort, a cross-agency effort, and the Children's Cabinet convenes a cross-agency table to address, to support maternal and infant and parental health, and with a focus on the Black and African American communities, as well as American Indian communities who face some of the disparities and outcomes in infant and parental health. And so some highlights of the package that kind of rolls into the early childhood package is I know MDH will speak to their components where they expand family home visiting, the Community Solutions Fund, which is a flexible funding source for community-based organizations led by and for BIPOC communities, and then a Healthy Beginnings package. DHS already spoke to the doula care and the infant and early childhood mental health, and then the continuous coverage. But I just wanted to highlight a couple of areas where we work together across agencies to build robust packages, and that also some other areas where I just wanted to lift up that were larger investments in the governor's children and families package are, which you may have seen, the House already passed this bill, but an expansion of or an investment to provide universal free breakfast and lunch for Minnesota students, some components to create a mixed delivery pre-K program at MDE. And I know Shanine will talk a little bit to the other childcare investments, as well as some of those broader investments that were in the MDE package. So I think I'm glad to be here today and just highlight really quick some of the top line components and can help answer questions. But for the sake of time, I'll pass it over to Shanine to talk about the components at DHS, particularly childcare.
Thank you, Stephanie. So before I start, I want to do a quick introduction for those that may not know me. Good evening, Council. My name is Shanine Moore. I'm one of the Deputy Assistant Commissioners at Children Family Services. And so I work very closely with Assistant Commissioner Tiki Brown, who could not be with us this evening. However, she did want to share that, we have a huge package and we're only going to talk about childcare in tonight's presentation, but if there are opportunities that you would want CFS to come back, myself and Assistant Commissioner Brown would welcome that opportunity. So regarding childcare and what we're working on within CFS, and so we are moving towards a 7% family affordability standard. And so right now, our child care assistance program, we are working to change the rates and moving those towards that 75th percentile for the number of families that are served by child care assistance, while also, alleviating the wait list that we currently have within the program, which could also mean providing services for foster and kinship families within the program. What that could mean then potentially is that 1,800 additional families would be served, which could also amount to about 3,600 children each year. We are also, as a part of our child care package, interested in investing about $90 million per year in our early learning scholarship opportunities. And so that would reprioritize children between the ages of 0 and 3. And so that program serves about 9,000 children per year. We are also interested in working on the pre-K program and improving that capacity by serving up to about 25,000 4-year-old children in licensed and school-based care. And so we're hoping that by having this opportunity that we would be able to increase that capacity by 2027. And then finally, under the child care proposal, but not least, we are currently working with Department of Revenue and a few others around a Minnesota Child and Dependent Care credit. And it would be similar to the credit that we saw at the federal level a couple of years ago during the pandemic, but it would help to alleviate some of the childcare burden that families experience. And so that could mean potentially up to $8,000 of childcare for a family of 4 that have 2 children under 5 that qualify for childcare expenses. And so that opportunity would phase out beginning at that $200,000 per year mark, but then families under that earn about $100,000 per year would qualify for that. With the opportunity of that tax credit, we would potentially reach about 158,000 households. And then we're also working on supporting access and workforce opportunities for community. And so in doing so, in that proposal, we want to focus again on childcare programs and increasing capacity. As you may or may not know, childcare within the state of Minnesota is something that we are currently seeing workforce shortages. And so with this opportunity, we could increase compensation for workers, as well as the ability to recruit, train, and support current providers that operate childcare businesses. As a part of that work, we would be working very closely with DEED with the initiation of child care economic development grants, and then we would use that to help establish a DEED Office of Child Care and Community Partnership. So that is what I have to cover, and I believe there may be one more slide, but if there are questions regarding CFS, I will stay on the call for a little bit and can take questions.
So council members, are there any questions at all for Shanine?
Madam Chair, I had a question in regards to foster kinship and family members that adopt children or transfer of legal custody through the foster care system. Once that happens, then child care responsibility is passed on to the family. Are there any conversations and or addendums that will protect and or support those folks who, those grandparents, family members who incur that significant change in child care and in the child care component?
So thank you for the question. I do have my legislative folks on, but I'm going to take a stab at it, and then Jennifer and Nick, if you have something else to add, feel free to jump in. So as a part of the making child care affordable, there is opportunity in that legislative proposal to create eligibility for foster and kinship families. And so with that opportunity, then that could help alleviate some of that burden that those families are currently experiencing.
Hi, I'll just go off of that. Hi, I'm Jennifer Summerfield. I'm the Legislative Director for Children and Family Services. And yes, included in the budget is a change in the definition of family to include foster families and also guardians. So that would cover kinship families. It would cover families that are providing foster care to make them eligible for CCAP. Also, families who adopt a child out of foster care, not transfers of permanent legal and physical custody, but families who adopt a child are already eligible for CCAP. But transfers of permanent legal and physical custody would also be included in our changes, if that helps.
Thank you.
Outstanding. Thank you. That's amazing.
Madam Chair, quick question.
Yep, go ahead, Theo.
Hi, this is Theo Rose. Thank you guys, the presenters. The question I have is that there was a child care affordability bill that moved in the House that was passed. I think it was yesterday, or yeah, I think it might have been yesterday. I wanted to just check if that aligns with the proposal that you guys are discussing currently. It's HF 13. Are you familiar with it?
So Jennifer and Nick.
Yeah. Hi there. So
yeah.
Yes, that proposal does to a point. It aligns with what ours is. It includes the rate increase to the 75th percentile, which is one of the governor's budget proposals.
Okay.
And then it also increases the well, it increases funding for what we're calling the federal grants for childcare providers. They're grants right now, and we have a program to create retention payments ongoing. But what it does is it increases the money that's in the current pool of funds we're using that are ARPA funds, federal funds, and allows us to continue payments at the rate they are now until that program ends at the end of June. So it's helping ensure that providers are able to stay in business. Providers are required to use 70% of those funds to increase wages for their staff. So it has kind of a twofold effort, maintaining the supply of childcare and ensuring that workers have a slightly more livable wage.
Thank you. Thank you.
Mhm.
All right, thank you, DHS. I believe we're moving on to MMB.
Oh, I think that you might be me.
Oh,
I already presented, and so
So, okay, I'm just going by what's in the chat. Sorry, Stephanie.
no worries.
So Devin, you are up.
Perfect. Thank you. Let me get some slides up here. Okay, are you able to see my slides here?
Yep.
Wonderful. Thank you, Chair Hughes. Thank you, council members, and thank you, Linda, for inviting me. I'm going to share not the entirety of our deed budget items, but I pulled out some of the high notes, and happy to take questions or happy to discuss the fuller package with whoever wishes to. I should introduce myself, Devin Baldry, Legislative Liaison at DEED. The first program I start out with is probably or easily by far our biggest program, our most technical program. It's the Paid Family and Medical Leave bill, which has been moving throughout so many different committees this legislative session. Ultimately it would replace, I believe, up to 90% of wages up to a certain dollar threshold that's stated in the bill. There's a formula for it. And we know that Black and brown Minnesotans are most likely to be in jobs that don't offer paid leave as a job benefit. So this program would level the playing field across the state, across all businesses, and it sets the floor. So you could also work for a business that provides better than this, and that would be okay. But this is the minimum: 12 weeks of paid leave. You're taking care of a family member who's sick or hurt. If you have a child, if you adopt a child, morally, we know that these are things that need to happen. You need to take care of your family members and all of that. But we also see it on the economic end as a labor attraction, a workforce attraction, and really an equalizer for the small businesses who would love to offer this, but just aren't able to right now. So it comes in, I think we estimate it as the price of a cup of coffee per week per employee, and then it should begin paying coming soon. So we're hoping to front load some of the money, and then later on it will kind of run sort of like uninsurance. So that's what the program is based off of. The next program is the Main Street Economic Revitalization Program. We've run this. It's pretty new. We got it a couple years ago, and it came out of a lot of negotiations. So we're working on technical changes to this, but really it's intended to rebuild, refurbish, boost economic corridors. So think main streets, think strip malls, things like that, and really make those kinds of economic centers for cities and towns. So last time we ran the program, we did a few different cycles with our $80 million, and this time we are asking for $85 million. Next is the Expanding Opportunity Fund. This will be $40 million in loan capital, essentially, that will be administered by our nonprofit lenders. And this is supposed to go mostly to Black and brown businesses. And it's supposed to pair with another set of funding that we have, which is not state funding, but a federal program called the State Small Business Credit Initiative. Over the next 6 years, we're set to get $97 million. That's for small business growth investment. And we broke that money out into 6 different programs that are slowly rolling out, slowly launching. And 2 of them in particular will be heavily geared toward small businesses. And the feds gave a goal of all loans should be, or there's a 25% loan goal for SETI businesses is what they call it, which stands for socially and economically disadvantaged individual. Basically, they revamped minority-owned businesses and retermed it. And we want this money to pair along with that. So we have 2 different streams of capital, I guess you could work with. And also we set a goal of targeting 50% of the loan money towards SETI businesses. Next is a small business partnership program. It's at $7.5 million a year. This is for business development and technical assistance. Like, what good does it do to have all these programs if you don't know how to access them, if you are at a stage with your business where you're not eligible? And we know different communities are in different places. Some people have businesses that are formed, informally and not filed with the Secretary of State, which is, completely legal and all that. But then you may run into different eligibility challenges. And we saw that quite a bit, especially over the pandemic, where there were these emergency assistance programs, and then people finding out that they were not eligible for any number of reasons. So this money is really building up or added to a program that we've had good success with over the years. And then to complement that, the small business navigation program, $1.25 million per year, and then each year of the biennium, and then $1 million each year after. This is really people on the ground to help share all of these business programs that DEED has. And I guess really beyond that, to have a good knowledge of the landscape of both the public sector programs and also what's available out in the private sector. Just really having good, knowledgeable people to help you get through some business challenges or formation questions is what we're going for here. And this is Launch Minnesota. This started up a few years ago, really to focus on the innovative businesses, work on the startup ecosystem across the state. So this is coming in at $5 million a year. It's just a couple people that run it, but they do a lot of coordination, a lot of technical assistance as well. And then this is the Angel Tax Credit. We're doing $20 million per biennium. And for this program, it's a tax credit of about 25%, I believe, up to $125,000, basically to get people to invest in innovative businesses and startups. For the first 9 months that the program has funding, that money is supposed to go to Black and brown businesses, women-owned businesses, and so on. And really that money runs out so quick. This money goes very fast. And legalizing adult use cannabis. So this is a cross-agency proposal. There are so many agencies that have a hand in this bill, and DEED is actually quite small. But we want to just have a small role in startup financing, technical assistance, and then a little bit of the workforce development. We have the intent in the bill to, I guess, both, first give the benefits of this adult use legalization to the people who are most harmed by it. And that's what these programs are targeted toward. And also on the economic end, making sure that no one huge business controls the entire landscape of adult use cannabis. So helping to create kind of a craft industry and focus on the small business end of it. And now kind of shifting from our economic development and business side into our workforce. Every day we hear there are workforce shortages, can't find workers, which is, we believe half true, but not fully true. So our first program is called the Drive for Five. I do not get to name these programs. I might have given it a different name. But We want to focus $30 million in the biennium on 5 key industries where we think there is good growth. I think there's, good benefits, good wages, all combined, and that's tech, the caring professions, education, manufacturing, and trades. And I think across the entirety of the governor's budget, like in different agencies, you will see a big focus on workforce. The next program looks similar. It's targeted population workforce programs, whereas the Drive for 5 is a bit more straightforward. This one contains sort of 3 buckets of its funding. One is workforce development. The second is capacity building. And the third is sort of DEI focused grants. So for small and mid-sized businesses, because like I said, we hear that, there's not enough workers is what people keep saying. But before the pandemic, during the pandemic, after the pandemic, the Black unemployment rate is always between double and triple that of the statewide or the white unemployment population. So the math isn't really mathing there. Like clearly there are people ready to work, and we got to get those people, into these good jobs and make sure also that they are ready to work. And then next is another investment in youth workforce development at $20 million over the biennium. This is the program that we've run every year and we get good feedback on. And I should say that none of these workforce development programs are meant to replace any of the past programs that we've had, like Pathways to Prosperity or the African Immigrant Community workforce grants. These are in addition to those. So you'll probably see all of them later on. And I think last but not least is the Office of New Americans, which we were trying to and very close to passing last year before things kind of bottomed out, but making sure that we have someone who can kind of coordinate across the enterprise on really a whole host, not just economic, but a whole host of issues that impact the immigrant and refugee community. And with that, I would be happy to take questions.
Councilmember Joe, Chair Hughes has asked if you could take over the meeting. She's having an issue, a technology issue right now.
Okay, sounds good. So what questions we have, if anyone has questions? I don't see anything in the chat. Is there any questions?
Councilmember Nadi has his hand raised.
Nadi, yes, okay. Councilmember Nadi?
Yeah, thank you. Thank you for the presentation. It's loaded, and really appreciate the effort you guys are making, especially to reach out to underserved communities. So one thing is the Main Street grant. So we are currently working on one, the one that was passed last 2 years. So, but what happens is that the way it was structured, it was targeting some areas, but once you go beyond the Minneapolis area, like Brooklyn Center and Brooklyn Park, so those who don't have properties or buildings, they don't usually benefit from that, and you see a lot of Black communities don't own properties, so it's difficult to benefit directly the way it was structured last time. So I hope you'll be getting some feedback, and also to consider how to support small businesses that don't have that leverage and buildings to utilize the funding, because at the end of the day, the economic engine of the state is driven by those who don't have access. So I just wanted to put that, but we'll connect with you later because we're working on that as well.
Yeah, thank you for that. Yeah, like when we passed the bill, it was something that came out very late. It was very negotiated by both parties, and it's what we ended up with. But ever since that, and how we've seen it kind of play out, exactly like you say, there's a lot to improve upon. So we've heard from several on tweaks that we need to make. So happy to.
Yeah, and I also want to add that the $1 million for navigation is non-starter. So it's down too small for navigation because that's where you try to bridge the gap and then bring it down to the grassroots for people to understand what's going on, explain to them, interpret, and it takes a lot. So I don't know if it's still opportunity to upgrade that, but navigation is also important to reach out to underserved businesses.
Yeah, I think so there's one other business program that I left out just for time's sake. So we'll have this for technical assistance that will be granted out to community partners to also kind of help do that end of things and bridge that gap. And then the navigation will be sort of Deed doing the work also. And I think this will fund I think it's 9 employees across the state, which is, not really a whole lot, but part. And then the one I left out is for our Small Biz Development Center. It increased to their funding because then they will be able to take more calls and offer more of that technical assistance that you can just call and access for.
Thank you. The last one. So the way the entire grant and the funding will be structured, definitely those small businesses, communities that don't have access to have a language in the bill or in the budget to make sure that small organizations, small consultants, small nonprofit organizations will be able to access this funding. So what happens generally is that the big organizations that have name, they will get the money, and then they will pay peanuts to the communities to do the actual job at the grassroots. So if the same thing happens this time around, some of us will be marching down to the Capitol. So.
Okay, that sounds good. You made your point, Councilmember. Thank you, Dylan. We have to move along because we're pressed here with time. How many other speakers we have? A couple more?
I believe I'm the last one.
Yeah, we just have one more. And then if you have additional questions, you can send questions to me and I can send those to Devin, or Devin can put his information in the chat and you guys can have a direct conversation.
Sounds great. Yeah, it seems like we have a lot of follow-ups to do here. So let's move along to the next speaker.
Great. Well, I'm Lisa Timian. I'm Legislative Director here at the Department of Health. And no offense to any of my colleagues at other agencies, but I always say we have the best mission in state government because our mission is to protect, maintain, and improve the health of all Minnesotans. So just a couple proposals to highlight for you all. We're really excited. We have a lot of really innovative and interesting things that we're pushing as part of our governor's budget proposals this year. Lessons learned from COVID, really building back stronger and really taking on disparities in health inequities in the state. So one of the things through the Mind, Body, Soul that we had heard about was dealing with addressing the root causes of health inequities, especially those that disproportionately impact African-American communities in our state, which of course results in excess morbidity and mortality due to intergenerational effects. So one of the ways that we want to address this is by establishing an Office of African-American Health here at MBH, which would really be focused on developing solutions and systems to address identified disparities, both for Black health rising from historical discrimination and disadvantages throughout systems. So part of this is really going to be engaging across sectors to provide policy and program recommendations to improve health outcomes for African Americans and issue grants to address fundamental issues that affect health outcomes and immersion experiences for secondary education and community college students to improve workforce diversity. I don't know if any of you have heard Commissioner Cunningham speak, but she has a really powerful story of having a Black pediatrician when she was younger, growing up in Richmond, Virginia, and then really being able to see herself as a doctor as she got older. And just, we know that sometimes you have to see it to be it. So that's one. We're also, building back as an agency from COVID. We know that it's really had an impact on people seeking preventive care, which is really what's key to,
improve chronic disease outcomes, and promoting culturally responsive care through grants and contracts. So one way to help address these health disparities is going to be grants and contracts for community-led innovative approaches to support community health workers, telehealth, and mobile care sites. This also includes, we're going to be hoping to pilot a telehealth proposal in public libraries in 6 locations around the state, which would allow folk who don't have broadband access at home to access telehealth through a secure and private location at a local library. We also want to support long COVID survivors by raising awareness and improving coordinated care and evidence-based strategies to assess the effects of long COVID on Minnesotans, as we're just kind of now starting to understand what that is. So what this would do is would establish an infrastructure here at the department to assess and reduce the human and economic toll of long COVID by engaging with communities, healthcare providers, employers, schools, local public health partners, and Minnesotans who are experiencing long COVID. We also have heard that communities that have been disproportionately impacted by inequities can successfully compete for grant opportunities, improve partnerships between the department and community-based organizations, but we really need to be focused on that. So one of the ways we want to improve equity in our grant making and procurement, it has been a long day, is about reviewing our internal grant making policies through an equity lens, providing guidance to agency staff on strategies to increase equitable procurement and grant making at the department, and developing metrics and progress so we can track progress over time to promote continuous improvement here. We also really want to improve the infrastructure for community-based organizations led by and serving Minnesotans most impacted by health inequities. This would include providing technical assistance and capacity building grant opportunities to community-based organizations, including faith-based, to really help organizations better access resources available through state grant making. And then the comprehensive drug overdose and substance abuse prevention. This is a huge focus for the department, the lieutenant governor, and across our agencies. We really need to reduce racial disparities in drug overdose. We know that Black Minnesotans are 3 times more likely to die from drug overdose than white Minnesotans, and are 4 times more likely to be treated in the hospital for a non-fatal overdose. So we want to establish community hubs to enhance both housing and supportive services for people experiencing homelessness who are at risk of overdose. We also recently released a report on homelessness and mortality in Minnesota. It was really groundbreaking. We're one of the first states to ever do anything like this, but it's really stark and pretty despairing to see really how much worse the outcomes are for people experiencing homelessness once you start looking at, especially for Black Minnesotans and American Indian Minnesotans. So ways that we want to support better outcomes for people and families impacted by substance and opioid use disorder includes new requirements to require grant resources allocated to disproportionately impacted communities, along with ongoing funding to support the grants for both traditional healing and overdose prevention. We also want programs to meet evidence-based standards, and we'll invest data and evaluation infrastructure. We also want to promote integrated service delivery models to help alleviate administrative burdens for providers so that they can spend more time providing care. And then just a few others that I want to highlight. We have a ton more. Happy to have, I know the slides will be shared with you all. Also happy to connect with folk who want to learn more about any of these proposals. But some that I really want to highlight are Community Solutions Fund that was established in 2019. This would add it to the base funding, which would mean this is like an ongoing program that we have here at the department to really help community-based organizations improve child development outcomes from prenatal period to 3rd grade by being able to do what works best for their communities and really target these investments to what is going to make most sense for the people they work with. We also want to establish a grant program to help community-based organizations and local health departments across the state develop and implement solutions for mental health including promoting social connection, access to clinical mental health and other supports, and community dialogues to promote well-being and trusted resources related to mental health. And then there'll also be funding for community health workers, which just includes more employment opportunities for these community health workers, which we know are really important because they come from the communities, they know the communities they're serving in, and then a plan to expand our infrastructure to support more of them. So that is us in a nutshell, and my email address is in here as well. Happy to answer questions, and also happy if any folk want to reach out and talk and learn more about some of our work.
Thank you so much, Lisa. Thank you for that presentation. Unfortunately, we definitely, I'm sure, will follow up with some questions that we can provide to the council going forward, but we really appreciate the presentation. And because of time, we want to move on our agenda. So I believe we are at the point unfinished business. So there's 2023 meeting calendar dates. Linda, you want to just go through that with us?
Can I just quickly, can you all hear me?
Yes.
Okay. Just
Oh,
quickly.
you're back. Good.
Yeah,
Okay.
when it rains hard where I live, my power goes out, so it's fine. We missed the public comment, so I don't want to negate that. So I don't know if we have any public members that have any questions or comments that are on the call. And I am not seeing, oh, Derek?
Yeah, hi.
Go
No
ahead.
comments quickly, just real quickly. Sorry, you guys, I don't have a presentation. Just a quick introduction, please. My name is Derek Emery. I am the new African Heritage Community Coordinator for the Department of Education. I work out of the Public Engagement Division, and I just want to come in and introduce myself and form a partnership with you, find ways that we can better impact and empower our communities. My whole role really is to be a representative, to facilitate department engagement with stakeholders of African heritage, to promote the programs of MDD. So again, just a quick introduction. Thank you for your time. I hope I get an opportunity to partner with you.
Thank you, Derek. And what we can do is set up one of, within the next, month or two, maybe next month, have you come back and actually present so that we kind of can gauge a little bit more about, what you do at MDE, but then also where the direct connection can be for our council and your organization. So let's plan on that, to have you come back and present in March. Any other public comments? Yeah, no, thank you. One additional piece, and I know that they were on and they jumped off, but I failed to acknowledge that we do have two representatives that have been added to our council. Representative Walter Hudson and then also Representative Cedric Frazier are also now a part of our council, and they were on earlier, but I know both of them had to jump off. So just wanted to acknowledge them. And because my voice is about to go away, Wayne, I'm gonna turn it back over to you to finish it out.
Okay. Let's continue. Let's go through the dates, Linda, quickly.
I will share my screen right now.
Okay.
Okay, this is the meeting calendar. We are at February 14th, which is our council meeting. And then we didn't change too much, but if you guys can take a quick look to see if you see any dates that there might be a conflict. So this is for the rest of the fiscal year, the 7th to 14th March, April 4th, 11th, May 2nd and 11th, and then June 6th and June 13th. So that's for the rest of the fiscal year. And then for the remainder of the 2024, we did change the July 6th Executive Council meeting. Let's see. And I think we changed the full council meeting because I believe on August 10th, because there was I think a primary that day. And then I believe we changed the executive council meeting for November, and I will send this out as well. So don't worry if you're not seeing all of it. But and then I just noted that in December, we might cancel the meetings again, just like we did last time, unless there's some business. So this is the calendar for the rest of fiscal year 2023, as well as the fiscal year 2024. We will send this out to you, and then if anything comes up, please contact Chair Hughes. Any questions?
Okay, doesn't seem like it's questions. Now, Chair Hughes, I mean, I think given the fact that we have just 30 minutes, we may need to maybe table a couple of agenda items. You agree?
I do agree. And I was just getting ready to say that the only thing that I would say to talk about for unfinished business, which is the obvious, is the Day on the Hill. But Theo, I don't know if that's a part of your report, because then we can move that into your report and just kind of give it a highlight on that when you all talk about your reports. But as far as the new business, there's those items actually can be tabled until March, because those are more discussion items. The one that we can talk about really quickly is our meeting structure. We had talked about at one point in time, and this is probably maybe closer to once the snow is gone, is that we had talked about possibly either April or May being an in-person meeting. And then we also need to make a decision as we go into 2024 if we're going to go back to in-person meetings, or if we're going to attempt to try to do some type of hybrid model. So that's really, I just want to throw that out there, kind of, noodle on that, and then we can revisit that conversation next month. And then the other piece that real quick with the new business was having the conversation around speakers for 2023. So we already have Derek set up for March. But then, that would be the other conversations as we think, for the remainder of the months, then we would want to identify some folks. And then the statement for current events, that is really going to be more of an in-depth conversation. We had a pretty in-depth conversation about that in the executive council meeting. And so we know that it's really at one point in time, do we make a statement when current events happen? And where this is stemming from, if you all recall, last council meeting, we had a very robust discussion around the events that happened around the police for Brooklyn Center. And we know that some of our council members were directly impacted as a result of that. And so we wanted to get a small team together to really kind of talk about at what point in time do we actually make a statement on behalf of the council, and at what point do we either partner with other organizations, or if it's more of an individual aspect, then looking at something, looking at different ways that we can acknowledge it. And so that we're acknowledging the person that has been impacted, or the community that has been impacted as well. So those are just really quick things that I wanted to mention. Any questions about what I mentioned from the council members?
Madam Chair, just one clarification. For the Day on the Hill, I'll turn that to Ash and Flock Committee,
Okay.
because they're leads on that. Thank you.
Okay, all right. No, thank you for that, because I couldn't remember who was the lead on that. And so Ash and Flock and me, if you all want to talk about that now, and then we'll move to the reports, that would be awesome. Go ahead, Wayne, you were going to say something.
No, I wanted to actually, we'll get to that, to make a motion to table those things, because I think.
Oh, yes, thank you. We do need to have a
in-
motion for that.
Right. Do we do it now?
So, yep,
I
go ahead and
second-
make. Oh,
I second the
perfect.
motion, Crawford.
Thank you. All in favor?
Aye.
Aye.
Any opposed? Any abstentions? Awesome. Motion carries. Thank you so much for that, Wayne.
Okay.
All right, Flannagan and Ash, turn it over to you all.
Sorry, I had some problems with my microphone turning on. Currently for Day on the Hill, we have 115 people registered. We hope to have a little bit more. Usually a lot of times when people sign up for an event that's free, we see a couple, some drop off for folks who attend. So we're hoping to have a larger amount of folks who have registered. Ash is assisting me with the bulletin, is leading the bulletin. So we have been sharing that, advertising that in our bulletin and our social media, and we'll be having some advertisements in some newspapers, some print media, and which includes the Spokesman Recorder, Michelle, and the Sahan Journal. And we're talking to some other media outlets as well. So hopefully we will hear back from them to see what their capacity is in terms of having a conversation or advertising this event. We also have reached out to speakers. We're waiting to hear back from a few, but we are underway with elected officials. We've sent invites to elected officials and reminders today to see if they are able to attend and speak. And then, oh, sorry, I was reading the comments. And then Ash is currently working with vendors, in particular performers, to make sure that they are secured, but we have confirmed all of the performers for the event right now, so, and vendors as well. So those are the high level updates. We do have our partners sharing this as well, and I'll make sure to link the Eventbrite link in the chat. I will pause for questions.
Are we making sure that, although yes, it's great to have people registered, but are we also making sure that if folks don't register, we still want to make sure that they show up?
Yeah,
Okay.
It's not a, you don't have to register, but it's a good way to get a head count. And so folks put it on their calendar and then share it online and things like that, but we're definitely welcoming folks to walk in. But we would definitely like them to register in advance. It helps us with just seeing who's attending, especially with like our internal logistics and things like that. It's really helpful. So.
No, thank you for that, Flannagan. I mean, I figured as much, but I just because I know this is being recorded, and
yeah, that's good. Yeah, it's good to ask. It's free. It's a free event. Yeah, it's a free event. Everybody from the public is welcome to attend. So I think this is a really great opportunity for folks. You know, if you want to see elected officials, have some questions, or if there's an issue that you're really trying to push, this is the time to really do that, connect with like-minded individuals, learn more about the government, learn more about how policy is pushed and things like that. So definitely free, open to the public. Council, yes, and then Ash just said that we will have a registration table for the event for folks to check in and register. I think that's just helpful for us to see who's, just for our logistics.
Absolutely.
Yeah. Vice Chair Doe.
Yes, it's more of a suggestion because I know we talked about this regarding sponsor for the event. The suggestion is just from a community engagement strategy standpoint. There will be folks who will be attending from representing organizations, and I know Chair Hughes will probably do the welcoming. That will make sure we get that kind of information so we can either recognize or call by name these organizations just to make sure that they are recognized. I think it will help in terms of our commitment to the community that we are doing this together as one. Does that make sense?
Yes, it does. I think that that is a good idea. Yeah, I think it'll be good to, I'll make sure to include some of those folks in invitations. I know a few folks have already sent those out and connected with people, but we'll make sure to just make sure that if we have some, community members or community leaders attending, to recognize them. So.
Any other questions or comments? And I know, Wayne, in my welcome, I will be acknowledging folks as well as the council members, because sometimes we don't see everybody right away. And so I typically acknowledge you, as you all remember, and have you all stand, and we'll try and do the same thing for community leaders and other organizations. All right, we're going to move toward, if no other questions, let's go ahead and move towards the reports from the staff.
Flannagan, you are up first, so if you have some additional information to provide, you can do so.
Right now, the main focus is really this, and then continuing to work. Shoot, this just closed. I'm trying to send this link as well on issue groups, but really with the time frame and the level of excellence that we're trying to execute for this event, it's kind of taken up a majority of our time. We are continuing to work. Last year we had a roundtable, so we are continuing to work on connecting with those organizations and seeing how we can support each other in a way that's mutually beneficial. So I anticipate after this event that we will have a lot more interaction around that. We are also continuing to talk to the governor's office around boards and commissions. I think that's a really great opportunity, just kind of given some of the conversations that we've had today, to make sure that our community is a part of that. And it's great to hear that we have council members who are also attending additional boards as well. I think that just helps solidify some of the work that we're doing a little bit more. Just understanding that, with the size of our organization, it's really great to have additional hands on deck. So those are the updates that I have right now. I'm sure I'll forget as soon as I'm done talking. I'm sure I'll remember all the things that I didn't say, but that's all I have for right now.
Theo, you're up next.
Hey, all right. Good evening, everyone. So on the policy side, a few updates here. We in January, we welcomed a new research and legislative intern, Rashanae Ambers Winston. She is a senior in sociology and business major at University of St. Thomas. She hails from Minneapolis, North Minneapolis, I believe, and just deeply passionate about community issues. She's already a published poet, I believe, and really glad to have her on board, doing some really good work for us, learning about legislative process, and really supporting us. The other aspects of our work in January, as we saw through the presentations, the governor released his budget recommendations. The governor and the lieutenant governor released the administration's budget recommendations for FY 2024, 2025. And so part of our work in January was to really do some review analysis of those recommendations vis-a-vis inclusion of CMAH's priorities in alignment with that. And so we've been engaged in some evolving public conversations around the governor's recommendations and really around efforts to address structural disparities that impact our communities. And then I'll just go overview on some of the policy packages that we've been tracking, some of them longstanding. We had a major victory regarding the Crown Act that I'm sure everybody's aware of. Yes, the Crown Act passed both chambers and was signed by the governor at the end of January. And so it is now, well, it's in statute, but it becomes effective, I believe, in August of this year. So I want to just, as a council, I think we send congratulations to Representative Agbaje, Senator Champion, and all the community members and partners, public leaders who've worked on that bill to bring us to this juncture. I mean, over the years, and we want to also give kudos to ourselves as a council because we were definitely in that fight as well. Other bills and proposals: driver's license for all. Part of a coalition that's really been pushing this really a proposal that's really about fairness, but then also about safety and economic security, to allow undocumented immigrants to obtain driver's license if they meet every other requirement. And so that bill passed the House January 30th. And now, I mean, the sort of next phase of that effort will be in the Senate. Earn sick and safe time. That one didn't come up in the discussions that we just had with folks in the administration, because that's a bill that's really in the purview of jurisdiction of the Department of Labor. But that's a key priority for that department, and we've been partners with them in that effort. It's a bill that would increase access to earned sick and safe time so workers can, just recover from illness, health appointments, etc., go to health appointments, care for their children. It's a really important sort of workers' rights, worker support, family support measure. And we had the discussion about paid family and medical leave from Devin at DEED. It's a key bill, and I believe there's a hearing. I think tomorrow on that bill, or certainly this week. It's certainly making the rounds through the House, and we're tracking that process. And then the other measure that I will highlight here is the Restore the Vote bill. That's a bill that would restore voting rights for ex-felons after completion of their incarceration term. That bill has already passed the House. It passed the House on February 2nd. And so the next stage of that effort, again, will be in the Senate. So those are some of the things we're tracking, and I will leave it there for now to take questions or to hand it over to Linda.
Ash, do you have anything that you want to mention?
Sure. So it looks like my video isn't working. You'll all have to just listen to my voice, some ASMR for now. But CMAH staff earlier this February had the opportunity to host the International Visitor Leadership Program, which is a program run by the Department of State. This year's cohort featured 13 folks, 12 from Latin America and 1 from Spain. And they came to the United States to learn about civic engagement and increasing voter participation, and they came to Minnesota specifically to meet with CMAH and a couple of local Black-run and operated organizations and nonprofits to learn about how we're supporting the Black diaspora in the state of Minnesota. So the people that were able to be there in attendance from staff were Executive Director Sloan, myself, and then Flannagan, our Communications and Community Engagement Director. And we had a robust discussion for an hour and a half, getting to know about the political processes occurring in a variety of countries, including Nicaragua, Mexico, Spain, Bolivia, et cetera, and then we got to do some cultural exchange back and forth. So very thankful to the U.S. Department of State and Global Minnesota for coordinating that for us. And I would say that that was a big win for our agency. And our visitors were genuinely impressed with how we were supporting people over such a large geographical area. So thanks to staff, team members, and thanks to the council. That's all I've got to share.
And thank you, Ash, for helping get that set up. It worked really well. So I'm just going to give a few brief remarks because we are close to time. So pretty much been finishing the onboarding for Ash. And again, we are so excited that they are here. I could do cartwheels, and they have added so much to the office already in terms of even just the tools that we use. So I'm very grateful and thankful that they are with us. Kudos again, Crown Act. The office has been there, Flannagan, Theo, we've been trying to drive that and successfully have helped do so. And then Juneteenth. And so thanks for all the staff's efforts. So I've been pretty much doing a lot of figurehead type stuff where I needed to make sure that it was understood that SEMA supported various initiatives and that we were engaged in helping to drive them. So did attend the Crown Act and Juneteenth signing. Flannagan also joined me with that. I was able to testify in front of the Senate State Government Committee to just speak about who SEMA is, what our mission is, and then reviewed the budget with the Legislative Coordinating Commission. And I think Michelle's still on the line. So thank you, Michelle, for being so supportive and making sure that we have, that the Ethnic Council directors have what we need so that we can show up appropriately. I participated in a press conference for the governor's budget, did have a speaking role with that, and participated in Restore the Vote press conference. I was a supporter with that one, which was fine. We've been having a lot of dialogue with the ethnic councils, and Theo has joined me on this regarding the Office of New Americans. It's a immigrant refugee office that they are trying to establish. And so right now we're looking at what the statute says and then what our statute says and trying to make sure that there's not a lot of duplication of efforts. It's in addition to, as opposed to we're doing the same thing, which I think is critical for us to understand as well as all of our constituents. So looking into research projects, and I thanked Councilmember Doe earlier for some of his suggestions, but we're going to try to nail that down in terms of how we will proceed forward. Day on the Hill attended the CEI, the Center for Economic Inclusion, attended their Day on the Hill, and they were very supportive. So there are various days on the hills that will be happening, and we've got to make sure that we show up for these. You know, it was just interesting. I don't know whether she's the president or CEO, but she really thanked me and I felt it. She said, "Thank you so much for coming." So you don't realize how much it means to people when you support their organizational efforts. So the more we can do that and say, "Hey, SEMA's here for you," then the more we will receive that in turn. So that's kind of it. Chair Hughes and I met with our new Representative Hudson, and then we'll meet with Representative Frazier. So that's in a nutshell for the work that I've been doing in the council. And thank you again to the staff. I mean, amazing people. Thank you.
So any questions for the staff? Go ahead, Wayne.
No, quick clarification. Linda, you mentioned you testified before the Senate committee. Was that per their request or just to know who we are at SEMA? Or?
No, it was per their request. So it was the Senate State Government Committee. Theo, correct me if I'm wrong, but that was the committee. And that's also the committee that will be approving our appropriation budget, right? Is that correct, Theo?
Yes. Yeah,
so it was important for them to understand who we are. So it's myself as well as the other two ethnic council directors. And so we will, though, have to go back and then speak with them about our budget, which is one of the reasons why I want to make sure that the Office of New Americans, that we have all of that clarified. And just to go on record, we definitely support that office, the creation of that office. And we just want to make sure, again, that we're working together. And so far, we have a great relationship with the current, I think he's the deputy commissioner in that space or assistant commissioner.
Yeah, it was an introductory presentation to that committee and to begin conversations about reviewing the budget, etc.
Right, that sounds really good. Thank you.
Any other questions for the staff? I mean, awesome work that you all are doing. I mean, the stuff that's coming out of the legislation, you know, we're hoping for big wins. I know that I attended the legislative breakfast this morning in reference to Minnesota State. And so, you know, everybody's hoping that their legislative ask is accepted. So, I mean, fingers crossed in some aspects, but then we know everybody's not going to get everything. But the more and more that we can push for equitable practices, you know, specifically that are conducive for us, I think that's where the win-win is going to happen. Any announcements that anyone has?
Could I address the council for a moment?
Absolutely, Michelle, go ahead.
Great, thanks so much. And Linda, I wanted to just express appreciation for you helping us to get the word out about the Director of Diversity and Inclusion that the Minnesota Legislature has authorized and asked the Legislative Coordinating Commission as a central agency that serves both branches of government. They've asked us to create that position. And so if there's anything you can do to help get the word out on that, or if there are networks that I should talk to or reach out to, please let me know. We're very excited about it.
You know, Michelle, send that to me because we have a network at the college. And so we can get that sent out to those folks because we do serve adult students. And
Great.
so a lot of them either have already had degrees and they're just coming back because they want, you know, something different. And then also I know Ash is the one that really kind of works with our newsletter now, and they can get that put into the newsletter as well.
Great, thank you so much, and thank you, Ash, for your assistance in getting the word out, because it did get in the last newsletter. It got out almost right away once we posted and made the position available, so we really appreciate it.
Perfect.
Great.
No, thank you.
I will make sure to post it on our social media as well.
Great, thank you.
Awesome. Any other announcements? Well, listen, we had, go ahead, Jude.
Yeah, this is not an announcement, but just with this legislation that is going on now, if we can invite this Speaker Hotman, Senate President Bob Champion, and Senate leaders, so that they can support some of our priorities. So if that can wait till next meeting, so if there could be a kind of meeting or something that we can connect with them, I think that would be very, very important to push for some of our agenda.
Well, I know that's kind of the point too of Day on the Hill. But yeah, I mean, we had talked about that possibly having them come to one of the meetings. I know we were hoping for this meeting, but schedules didn't work out. And like I said, Representative Frazier and Representative Hudson were on, and we know that this is kind of a high time for our legislators, but that could potentially be a speaker or speakers that we could have for March. We would just have to work with them now to see when would it make sense for them to come on board. But yeah, I echo that, Jude, to have them come and make sure that there are alignment in our priorities.
Thank you.
You're welcome. Any other announcements or comments? Oh, Wayne, you're muted.
Okay, no, I wanted to add to what you said and what you said. I mean, an opportunity too, you know, once we're on the Hill, we could stop by the offices just for 1-2 minutes and you know, talk about things that we want them to know too as well, because they should be open to that if we have the time to do that.
Absolutely. Well, with that, if I can have a motion to adjourn.
So moved, Nadi.
Is there a second?
Second to hear.
Thank you. You all have a fabulous day. Happy Valentine's Day again, and be well. Bye-bye.
Love you guys.